if someone is like diagnosed with Alzheimer's disease, it sounds to me like early interventions are gonna be very critical. So talk to us about like, all right, families, here's your checklist. I want you to go see this person, this person, this person, and this person, so that you can get a comprehensive care plan for your loved one.
Right. And I'm actually going to sort of put that in a context of because of those pain points, right? So I used to work in hospital systems where everybody was at least under the same roof, and you had a shared electronic medical record system, so you could sort of, talk to each other a bit more easily. I don't know what it's like in your area, but definitely in our area, it's not uncommon for most of these providers to be in their own independent practices. So now no one's under the same roof. So the conversation has gotten even more fragmented between these doctors, and it becomes the caregiver's burden to run from this doctor to that doctor to that doctor. And I've seen it for over, I've been a clinician for over 20 years, and it's just heartbreaking to watch these poor families who are already dealing with a lot on a day-to-day basis, caring for the person with the disease, but on top of that, like you said, trying to navigate the system. So about a year and a half ago, I actually started building a platform, which is a multidisciplinary platform where we have primary care physicians, pediatricians, mental health providers, neuropsychologists like myself, and we can all securely talk to each other with the family's permission, taking that burden off of the patients, right? And then the patients subscribe to one main person who's their point person on the platform, sort of like their therapist or their case manager, who is communicating with them, but then that person's communicating with the whole team. So first thing is, I would say to families, don't try to be everywhere. It can be a lot because you go to a doctor's office and they give you a slip. Well, go to this department, call radiology for imaging, call the neurologist for this, right? Go to the pharmacy for that. And gosh, it is really overwhelming. So do request and see where can they kind of bring this care together for you as a team, and you have one point person that you're dealing with, because that can really help. So that is one piece of it. Two is peer support systems, right? Get plugged into other folks, other families who've gone through this. And like I said, the Alzheimer's Association is a great resource for that. Look for your resources in your local community. Oftentimes there are rehabilitation or memory care centers, they're called, right? So a social worker at a memory care center, for example, can often be your point person who can help guide you in terms of, here are the resources. So really don't feel like you have to do it alone, because if you haven't gone through it before, how are you supposed to know how to successfully navigate this, right? So reaching out for that support sometimes in navigating the system can be very helpful rather than just trying to navigate it yourself.